Hello, today I'll be discussing trigger finger. Trigger finger is a common condition that can occur in anyone. It can be locking of the thumb or any of the fingers. It's usually worse in the morning and really painful when the digit unlocks. It can affect anyone but usually women over the age of 50. Diabetes, low thyroid, and rheumatoid arthritis are common diseases that can predispose you to getting them more often. The pathophysiology is simply swelling of the tendon or nodule in the tendon that prevents it from gliding freely in the palm of the hand. And the exam is pain in that area, which is called the A1 pulley. And the imaging studies are usually negative, so I usually do not obtain x-rays for these conditions. The treatment in the office is usually with cortisone injection therapy and anti-inflammatory medications. We often will recommend surgery if these conservative treatment modalities fail. And in rheumatoid patients, I'll only do one injection because of the risk of tendon rupture, which can often be worse than the actual trigger finger in the first place. It's important to think about the early detection. So you can start to have stiffness in your fingers in the morning, even without locking. That's often the precursor for trigger finger. So if you notice that at home, often taking over-the-counter anti-inflammatories such as ibuprofen or Motrin or Aleve can help alleviate the symptoms for about 1 to 2 weeks. And doing stretching of the fingers, I think that's usually something that can help resolve those symptoms and prevent you from seeking care from a hand surgeon like myself. So in testing for trigger finger, I look for swelling of the digit. I also know where the A1 pulleys are. The A1 pulleys are the pulleys that the tendons glide through, and they're usually painful. So the A1 pulleys are located around here. So if it was a trigger finger or the middle finger, I would push down on that A1 pulley. And sometimes they haven't even started to develop locking or triggering. So if I push down and they have pain, and then when I move the finger up and down, I can sometimes feel a crunching sensation, just such as when you're crinkling a piece of paper. So that's really the exam for trigger finger, and then the injection would often be right there, and then the needle will infiltrate the steroid in that area. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.